Hello, my name is Dr. Basavaraj. I'm a consultant gynecologist, fertility specialist and practice andrology. I practice at my clinic Vishwas Fertility and Andrology Clinic in Marathalli, and I also work in Cloud9 Hospital in Old Airport Road. Management of male infertility depends upon how bad the male semen parameters are. Is it a mild or is it a complete azoospermia? So before going that, we have to identify any factors which lead to the low sperm count. Like we have to ask him to be stress-free, eat healthy diet, do exercise, lose weight, and take some antioxidant, multivitamins, and have a good relationship, with his wife. And the treatment involves, if the count is just minimal, after consultation with the doctor and doing some blood test and repeat semen test 2 or 3 times, still persists that the count is less, then we can prescribe medication for him to improve the count. The medication which you need to take, at least he has to take for 2 to 3 months. People do take for 15 days and leave it, it doesn't help. So because the sperm production cycle takes 70 days, so he has to take at least 2.5 months the medications to see whether actually it has made any difference, the medicines have made any difference to the sperm parameters. So he has to take medication for at least 2.5 to 3 months along with some antioxidant and multivitamins for 2 to 3 months. And subsequently he has to repeat a semen test to see whether the sperm count is going to improve or is going to be the same, or is it got worsened. And if it got worsened, then we have to tell them that they have to get pregnant quickly, because sometimes if it doesn't improve, it is not going to improve, and subsequently the sperm count can go down and down and down over a period of time, until the time basically it may go into zero after a couple of years. So we have to advise him that the count is very less, and most probably it may not improve. They should try to get pregnant quickly as soon as they can with any sort of treatment. Whatever the mode of treatment they want, they can get a treatment after consulting with the doctor. That is the one thing. Second is azoospermia. Azoospermia is absence of sperms, and we need to find out whether is the production problem or is the block problem. If the production problem, then he has to undergo a testicular biopsy to find out whether is there any sperm production still going on in the testicle. The sperms are still available after doing a biopsy. We can store them. Once we do biopsy, we get the sperms, we store them or freeze them. Freezing is what we say in the medical terms. We freeze the sperms, and so that we can utilize those sperms during his wife treatment. And she has to undergo IVF or test tube baby, what we say IVF or ICSI treatment she has to undergo. If it is non-obstructive, means the production problem is there, in 50% we may find the sperms after biopsy, and 50% we may not find sperms. If they don't find sperms, then they have to think of going for donor sperm, or they have to think of adoption if they are not willing for donor sperm. If this obstructive azoospermia means something is some block, so either we can correct the block or we can extract the sperms and undergo IVF or ICSI treatment. So that's how we have to deal with it, and these things should be seen by a specialist and need to be treated quickly.